Okay, so working the whole foot, we're going to come in, apply some pressure through here. Don't forget to breathe, Jeremy. Okay, so a gentle rotation of the ankle combined with holding these nice pressure points here. Just gently shaking them, holding here as well, shaking them. The shaking helps to spread the sort of unblocking of the chi through there. Now we can get into his calves a little bit more vigorously. Flicking over that. Again, alternating moves to save your hands and also to make it not so intense for him. But he can still feel it. You still feeling it, Jeremy? Coming back and forth, so again, a bit more on the foot. Just letting him enjoy that spot for a little while. Adding a little bit of flavor. Seems to be quite tight in there. And back into here. And then just gently holding both those. Here I'm rolling on the side muscle here, which you can see through here, where he's quite tight, just in there. You can even just do direct pressure through there as well. Okay, a couple more of these, coming up the leg. And then a little bit of gentle elbow leaning in with the body weight into here. And just get you to leave your leg there, that's it. Don't forget to breathe, especially if it's a little bit uncomfortable. See, it's a little bit, again, tight for him here. Could even use our thumb. And we could alternate that with some of these. Making sure we're bouncing, of course. Not pounding them, but just bouncing there. Okay, still a bit tight in there. You can see here, it's actually where he's really tight. Roll over that muscle, it's very tight in there. Okay, that's also going to play a part in the front here, which is again where we're seeing that chest problem coming from. Okay, so this area here will be connected with that belly tension, then coming up through here, causing some problems with this side of the rib cage. Okay, we can hold in here. Just relax, Jeremy. So he's definitely feeling it. Had to ease off a little bit, just to let him. So we'll just get into this other side here a bit. Still feeling that tension in there that I felt originally. Okay, so I'm going to get into his foot. Apply a bit more pressure here. So he's sort of getting used to it now. He's almost enjoying it. So again, getting into that edge of the foot, doing some nice pressure through here. Another way to work this is by having the foot like this. You can just gently apply some pressure with the elbow. Mix it in with some finger pressure. Just feeling where it's tight and working over it. And then again, just a few more here. And then just some nice, letting him breathe. Don't forget to breathe into your belly. Nice rotations there. Open it up. Just a bit of gentle pressure through there. And in here as well, and then just shaking it. And then working up the leg. Don't forget to breathe. So again, just getting him to breathe. Obviously don't bring his foot too close to your nose if he's got smelly feet. And we're just applying a bit of pressure through there. Now, these areas here I want to get in the side position, okay? So I'll just do a little bit more through here, and then I'll get him on his side, either side, then I'll do a bit more on his front and finish him up. Okay, so what we're going to do, Jeremy, is just get you on the side facing the camera. I'll roll this up a little bit to give you a little bit of a pillow there so you're comfortable. I'll get the bottom leg straight, top leg bent. First of all, we're going to do a bit of a stretch for you. So we're going to get in front of the shoulder, back of the hip, getting him to breathe in, big breath, out breath, stretch. And then time for a little rest for me. Oh, geez, it's been pretty hard work. Stretch him. And then we can get into the sacral area, which I'll show you when I work the other side. That's more into the hip again. So we're going to work that sacral area, come up into his back, following it right up, and right up into his neck a bit there. Okay, so we'll just get you to roll over the other way. Same position, bottom leg straight, top leg bent forward, coming close to the edge of the table. That's it. Big breath. Okay. Then we're going to get into along here. Okay, just above the sacrum. So we're working here in the where this muscle comes beside the sacrum. So not on the bone, although there will be some bone underneath there, but not the actual spine part of the bone, or the sacral part. Then we're going to follow that up. We can use our thumbs, we can use our elbow, if you're steady with your elbow. Make sure it doesn't fall off the table, of course. Then we can also do some